Welcome. My name is Elizabeth Rossi, and I am in the Applied Informatics program at Stony Brook University. And today I'm going to talk to you a bit about the Affordable Care Act and how it's working to help manage something that a good portion of young adults may be too uncomfortable to admit to struggling with: weight gain, or the main topic of this video, obesity. The target of this video is to educate you on the Affordable Care Act and what it's doing to help address the concerns some of you might have regarding getting the care you need to manage your condition, or can you actually afford to get help, etc. So without further ado, let's get started. So let's put things into perspective. As of 2011 to 2012, statistics showed that 40% of middle-aged adults are obese, and not far behind them, 30.3% of young adults are obese. This is a constantly growing problem in the United States, to the point that obesity has been labeled as an epidemic. And it's not just the fact that having a high body mass index, or the ratio between your height and weight, in the obese range can be detrimental alone to one's health. But battling with obesity early on can increase one's likelihood of being obese as an adult and being susceptible to heart disease, diabetes, high blood pressure, high cholesterol, and high blood sugar, and that's only naming a few harmful conditions associated with obesity. And that's why the Affordable Care Act will become so important in years to come, because one of the major things it was created to do is to reduce the number of people in the U.S. with chronic conditions. Having such conditions can only be costly, but make for an overall unhealthy population. So addressing the root cause that is obesity is critical to the ACA's success. So now let's very quickly go over what it is that the Affordable Care Act did when it was written into law. First, the ACA helped bring about health insurance reforms designed to expand insurance coverage. And I'm going to get into what this means in a few more slides. The ACA also holds insurance companies accountable, meaning there's no discrimination for coverage and overall keeping insurance costs in check. Again, I'm going to go over this later. Lowering the cost of healthcare, which is a constant topic in the news today, not only helps the economy but guarantees more choice for users of the system. Not just about what insurance plan to choose, but for individuals to make informed and educated decisions on how to manage their own care. And all of these provisions are designed to enhance the quality of care and improve outcomes for all Americans. Now, you are probably wondering, how does this all pertain to me? You might just be getting ready to go away to college for the first time, or you are still in college, or like me, you're fresh out of college. Well, there are some notable aspects of the Affordable Care Act that were created to help young adults manage their health care, and in the case of this video, manage the struggle with obesity. Title II of the ACA addresses the roles of public programs. What you need to know about these sections of the ACA is that it extends insurance coverage, and for our cases, extends Medicaid coverage. And I'm going to get into more detail about this in a little bit, but what's really important to note here is that under the Affordable Care Act, children and young adults are covered under their parents' insurance up until the age of 26. So this makes for more young adults that are insured under the Affordable Care Act than ever before, and receive healthcare services they might not have been able to afford prior to health reform. Title IV addresses prevention of chronic disease and improving public health. This part of the ACA allows for better access to preventive services, which I will relate specifically to obesity in the next few slides. Under Title IV, communities are included in the promotion of prevention. For example, under the ACA, hospitals are encouraged to use their community benefit spending to expand their chronic disease prevention and treatment efforts, and must ensure that this spending is responsive to the needs of the community. The final part of the ACA that is important to mention for our purposes is Title V, which pertains to the healthcare workforce. There is more focus nowadays on the primary care sector and making sure that healthcare professionals begin to provide more services that are preventive. These focuses will help drive down healthcare costs and help those who haven't acquired chronic illnesses yet learn how to take preventative measures to address their obesity. Now, to truly understand the magnitude of what the Affordable Care Act has allowed possible for young adults battling with obesity, we need to take a look at what healthcare was like before the ACA. First, before the ACA became law, a lot of Americans were uninsured. Not only young adults because they could not afford health insurance, and there was not yet a law saying that they could be covered under their parents' insurance, but also because if an individual had any condition or potential health risk factor, such as being obese and having a high BMI, then insurance companies could actually deny them coverage because that person would be considered a risk for them to insure. As I've mentioned previously, health reform came into play because of the alarming rate at which healthcare spending was increasing. Funding for taking care of patients with obesity and other related illnesses alone costs billions of dollars annually, and it has also been noted that obesity contributes to the cost of health insurance according to the Centers of Medicare and Medicaid Services. Also, those who paid for insurance had overall increased costs, and the lower income population suffering from obesity had inadequate access to preventive care due to being uninsured. Also regarding health insurance, as mentioned before, private insurances could deny coverage to individuals based on any pre-existing conditions, gender, or health status, and there were also annual and lifetime caps on reimbursement, or limits to what the insurance companies would spend for covered benefits during a person's lifetime. And finally, preventive services were not yet covered under insurance and were not at the priority level that they are under the Affordable Care Act. There was more emphasis then on sickness rather than wellness of patients. Now let's get into more of the specifics of the ACA and how it's linked to the management and prevention of obesity, beginning with how it changes insurance. Under the ACA law, there's an expansion of Medicaid services which directly impacts the treatment of obese young adults. First, state Medicaid programs eliminated cost sharing for preventive services. I'm going to explain this more in the slides to come. There are also Medicaid initiatives for the prevention of chronic diseases, which states that state initiatives must address one or more prevention goals such as controlling or reducing weight, lowering cholesterol, lowering blood sugar, and or avoiding the onset of diabetes. Medicaid has also created financial incentives for providers and organizations to deliver nutrition and other wellness education to patients. Finally, Medicaid innovation tests innovative payment and service delivery models to reduce program expenditures while preserving or enhancing the quality of care. So, in other words, the goal of the expansions through Medicaid are to reduce healthcare spending while providing quality care. Along with changes to Medicaid, there were also changes and enhancements made to the public and private insurances, and some of these changes directly impact the treatment of obesity. Some private insurers, instead of paying fee-for-service to providers, are beginning to pay providers on the basis of outcome measures or pay for performance. A specific example of a public-private initiative is the Million Hearts campaign. The goal of this program is to prevent 1 million heart attacks and strokes over a 5-year period to reduce healthcare spending and lost productivity. This program was created to empower Americans to make healthy choices like reducing sodium and trans fat consumption. This has become an excellent educational opportunity for providers to link individual health, population health, and cost reduction in an outcome-driven strategy. Also worth noting is together, Medicaid and public-private insurance use the Healthcare Effectiveness Data and Information Set model to measure performance on care and service. Included in the model's measures are adult BMI assessment and a child or adolescent measure focused on weight management and assessment and counseling for nutrition and physical activity. All of these steps are used to encourage more disease prevention. Along with the changes made to insurance through the ACA, another major change was the greater emphasis on preventive care services, which are vital for the care and management of obesity in young adults. A specific preventive measure created by the ACA is the Community Transformation Grants that are designed to support community-based efforts to prevent chronic conditions such as those linked to obesity. The ACA also includes provisions for prevention and public health focused programs, which allow population-level obesity intervention efforts, community-based care that targets communities with unequal rates of obesity, and better research and data collection to ensure that work is being done to reduce obesity. Other preventive care services include the removal of costs as a barrier to service. Now, what I mean by this is that after the directions of the new health plans were established, they included coverage for preventive services such as obesity screening and counseling with no cost sharing. So preventive services that are recommended are free under most health insurance policies. The ACA also created a new prevention and public health fund that has funding of $2 billion as of this year. This prevention and public health fund will invest in a range of prevention and wellness programs that will be administered by the Department of Health and Human Services. Funds have already been invested in prevention research, surveillance, and obesity prevention. Something else that the ACA did to promote healthy weight in an attempt to reduce obesity is to create policies regarding menu labeling provisions that require the release of specified nutrient information for food sold in certain chain restaurants and vending machines. Along with preventive care measures, equally as important is that the ACA is designed to improve health outcomes. In this way, the ACA will help care for obese young adults through the use of electronic health records which aid with the collection of patient health information. Electronic health records, or EHRs, are intended to improve patient safety, outcomes, and reduce costs associated with uncoordinated, unnecessary, or duplicative care. But this year, the incentives for EHRs require meaningful use of data to improve population health. For example, data on how many of a community's young adults are obese, or information about how many of these young adults utilize preventive services, etc. This creates an ideal environment for the care integration required for effective obesity treatment of young adults. Another significant development that came out of the ACA was the American Medical Association recognizing obesity as a complex disease that requires a range of interventions for effective treatment. This recognition of the complexity of obesity and the fact that it has many associated chronic conditions encourages more prevention programs and treatment, as well as increased access for people battling with obesity to a range of treatment options. These provisions of the ACA are meant to create a concentrated effort by patients, physicians, and payers to address and manage the obesity epidemic. Speaking of physicians and other healthcare professionals, the ACA addresses the health profession by shifting focus from acute care to prevention. There is a need for improved nutrition and physical activity training among healthcare professionals based on public policy and institutional practices that shift towards an increased emphasis on primary prevention. The goal is to create healthcare professionals that are well trained to deliver effective counseling and care to patients. Through the further education of healthcare professionals on utilizing preventive measures, providers will be able to better inform and motivate patients around nutrition and physical activity behaviors, refer them to nutritionists and dietitians, and connect them to community-based resources to support desired behavioral changes. Finally, there is focus on conducting research to determine the best education and training models and their effect on healthcare professionals' practices, the consequent benefits on patient outcomes, and the impact on public health and related costs. Overall, the goal set forth by the ACA is to have an increased knowledge base from the provider that will inevitably help drive the fight against obesity end the epidemic. Now I'm going to give you some examples of what has actually been done to address obesity in young adults based on the provisions of the Affordable Care Act. Most young adults in the United States have access to mobile phones. Therefore, mobile health, or the use of mobile phone technology to deliver health care, is one of the best ways to reach the young adult population and provide preventive health care services. Text messaging in particular is something that most, if not all, young adults with access to a cell phone know how to do, and providing healthcare services via this mechanism may increase the likelihood of recipients remembering the changes they make to their health that they should be making. The text message health service allows participants to write their own reminder messages and incorporate information specific to their personal goals, age, or current health status. The results of the study showed greater weight loss in obese adults and greater decrease in hemoglobin A1C, which is associated with diabetes, in adolescents. This technology is both appealing to young adults who are more technically savvy and creates promise for this technology to be included in clinical practices to provide more effective disease prevention and management support for young adults who are obese. The final example is that calorie labeling in universities has proven to reduce weight gain by 50%. A study was conducted by examining food choices and weights of university students from two 36-week academic years. Similar studies have also been done in chain restaurants that have calorie labeling, but there have been mixed results as to the effects calorie labeling has on consumers' meal choices and weight. However, this research suggests that consistent exposure to prominent calorie labeling of main meals reduces the likelihood of young adults gaining weight over a 1-year period by 50%. In other words, with this provision of the ACA, it is possible to put the calorie labeling services in universities where young adults are constantly frequenting the cafeterias, vending machines, and snack bars. This would allow for real prevention and management of obesity to take place and get young adults to start eating foods with less fat, saturated fat, and frying oils early, and this will inevitably prevent them from becoming obese adults or having associated chronic illnesses. To conclude, the Affordable Care Act has many provisions that help care for young adults struggling with obesity. Now that young adults are covered under their parents' insurance until the age of 26, this allows more young adults battling with obesity to access health care they need without the restriction of being uninsured. Preventive care services are free under the Affordable Care Act and promise to provide young adults with education to help them manage their obesity, allowing them to receive counseling and screening as well as benefit from some measures that have been strategically placed in their everyday world, such as calorie labeling. The refocus of improving outcomes allows for data to be collected to determine the best methods to treat the obesity epidemic and allows for obesity to be taken more seriously as a complex disease with multiple comorbidities. By giving healthcare professionals nutrition and physical activity education, this prepares them to motivate and help their patients combat obesity and refer them to seek out preventive care services. Finally, the ACA provisions relate to young adult obesity are not just words on a document. They are being put into action across the country in the forms of mobile technology and calorie labeling to promote better prevention and management of young adult obesity. Addressing obesity in young American adults can help decrease the number of young adults that become obese adults, thus reducing the number of chronically ill patients and driving down the cost of healthcare. So thanks so much for watching, guys. I hope that this video has been informative and that you've learned a little bit more about the Affordable Care Act and what it has to do with young adult obesity. If you have any more questions about the topic or you want to learn more, please check out my wiki page. Thanks so much, guys.